A very warm welcome to Health 2020. I'm Dr. Sello Daung, and joining me on Skype is our co-host.
Good afternoon, everybody. Welcome to the show. I'm Dr. Doreen Monakisi. You know, Sello, I'm very excited we are covering hypertension during COVID-19. In my time in practice, I've encountered so many people with hypertension and hypertensive complications. I'm hoping this will be an insightful session.
All right, well, high blood pressure or hypertension, as we know it, is a silent killer. And recently we've learned that if you have high blood pressure, you are at risk of becoming severely ill from COVID-19. So today we bring you the most important facts about hypertension, how it relates to COVID-19, and most importantly, respond to your questions on this subject. And to help us with that, we have a heart specialist in studio. But first, let's take a look at what people with high blood pressure have experienced during this pandemic.
Ngithole nge-2013 ukuthi ngine high blood. So bengiqeda ukushayisa ku night shift. Ngizwe ikhanda lami lingishaya, ngizwa lapha kuma shoulder wami I heavy. Uma ngihamba ngiye clinic eSan10, then bangicheck high blood. Bathola ukuthi high blood yami is 170. Mina ngimele ngihambe ngiyobona idoctor. So but udoctor wantshela ukuthi there is no medication lo uzoqeda high blood, which means mina ngimele ngijwayele ukusebenzisa ama medication as usual ngoba it's the rest of my life mangisebenzisa medication. I-exercise yami from work ngisebenzela eSan10, ngiyawalka from distance eSan10 to Alexander, and I always walk 1 hour. So mangiqala medication bekungekho easy ngoba like mangikhula bebahlala basitshela ukuthi mawungaba ne-high blood, i-high blood i-dangerous. I-COVID-19 mayiqala ukufika bekungekho easy ngoba noma masihamba ama-check-up esibhedlela bekungekho easy ngoba bekugcwele queue, and then sometimes no medication besingawutholi, and mawuphelele ngo-medication once umele umake sure ukuthi uyawuthola, noma mawungana imali umele uboleke uhambe uyothenga i-medication e-chemist. I-life yami manje i-easy like before mangiqala ukuthola ukuthi ngine high blood. So manje already sengijwayele nemzimba wami like awukho heavy, ngiyakhona uzwa umzimba wami ukuthi u-right and then u-normal.
Ngithola ngiphatha inhloko lengapheli. Icala nje lenhloko because of some marital problems. I felt like imisipha le ngathi ifuna explode. Then I decided, no, let me go to the clinic. Uma ngifika lapho, I remember mangifika clinic, it was a white sister lady. She said to me, my goodness, what happened? This is the highest I've ever seen. So when the sister said to me, I'll put you on medication, then I remembered, I have a friend, I had a friend who was on BP as well. And she told me, once you are in BP, those tablets is just like forever. You stop the day you die. And then I imagined, no, I can't be helping this thing, this medication yet. Ngati sister, can I just go and try and be good with my health and everything? She said, you can, but please, I need to see you after a month. I went back because this head wanted to explode. Went back to the clinic. I was given medication to take every day. And so I decided that every morning, when I wake up every morning, I'll take hot water with lemon. After that, I go to the gym. Straight after the gym, I come back to the house.
So it's a great pleasure to welcome our expert into the studio, Dr. Maya Yise, who's a heart specialist or cardiologist based at the Mediclinic Heart Hospital out in Pretoria. Welcome to Health 2020, and thank you so much for your time.
Thanks, Dr. Silo, Dr. Monakis, and the team. Thank you for the privilege and the honor. Thank you, sir.
All right. We've just played those two clips, about people obviously sharing their experiences. But let's just start from the beginning. They're talking about high blood pressure or hypertension. What is this?
So high blood pressure basically is the condition of the heart and the blood vessels. So the heart is a pump that generates pressure in the body to push the blood to be able to get to the organs. So when the heart contracts, it generates this pressure. At the highest point of the pressure, then we call it systolic. And then when the heart relaxes, then at the lowest point of that pressure, it's called diastolic. And then there is a classification of this blood pressure. The normal one is when the systolic blood pressure is below 120 and the diastolic is below 80. And then once it goes above 120, But if it's below 140 over 90, between those two ranges, then it's high risk. And then the diagnostic part of the hypertension is when it goes above 140 over 90. Then that's when we call it hypertension.
All right, okay. So we've heard people describe, a variety of symptoms. Are there any typical signs and symptoms, and why is it called the silent killer, by the way?
So hypertension is called a silent killer because the blood pressure goes up, the damage happens while somebody is not feeling anything. So for the most part, it's asymptomatic. By the time they feel something, most of the time it's when complications happen.
So you talk about complications, and I suppose that's why we worry about this condition in the first place. What are the sort of complications we can expect from hypertension?
So hypertension affects blood vessels, and the blood vessels go to all the organs. So if you think about it from head to toe, from the brain, if the blood vessels are affected there, then you get a stroke, you can get disabled and being unable to walk, being unable to move, being unable to eat and do all sorts of activities. In the heart, you can get a heart attack, you can get heart failure. And then in the kidneys, you can get kidney failure. It can go as far as even affecting the sexual performance in a man. You can get erectile dysfunction from that. And you can also get gangrene in the foot where they need to amputate you or not. So it is all these vascular problems that you can get due to hypertension.
Yeah, certainly bad ones that we don't want to. And I mean, this is a common condition. We didn't even talk about statistics yet, but I mean, it's quite common. Let's just talk about the link now between hypertension and COVID-19.
So firstly, COVID-19 is a disease of the lungs and the blood vessels. Hypertension is a disease of blood vessels. So we do know that when patients do happen to have high blood pressure, if it's uncontrolled or it's untreated, they are likely to get a severe form of COVID-19, which might lead them to being hospitalized, ICU, and unfortunately, some of them can even die. And then the other issue is with the restrictions of lockdown and movement restrictions that we have. Patients with hypertension, some of them are not going to collect their medications, and then hence they start developing much more complications, which makes things even worse from the hypertension side. Yeah. So this interaction sort of makes things worse for hypertension patients.
I mean, you mentioned the fact that those with hypertension and other chronic conditions, are at more risk of developing severe illness.
Yes.
But can you just put this right once and for all? Some people think that they're at higher risk of contracting the virus if they have these conditions. What's fact? What's fiction?
It's not the high risk of contracting the virus. The risk is the same for everybody. It's just that if your hypertension is not controlled, if you contract it, you are more at higher risk to get the much more severe form of it, which now requires ventilators and hospitalizations and those kind of things.
All right.
Yes.
Yeah, I'm sure we're going to have time to interact a lot more with our viewers on this subject. Time for a quick break from now, but when we come back, we'll hear more about what some of you asked us about hypertension. Please stay with us.
Bengawafuna amapilisi ngiwathathile bengawaphuzi kahle sometimes ngiyaphuza sometimes ngiwashiya ngibona ukuthi lento lezi ngiyenzayo lengiphuzayo le mapilisi lengathi abanye bangitshela ukuthi nela amapilisi lawa mawaphuza
manje ngi-right ngoba ngiphuza amapilisi angikwazi ukuphuma ngingadli ngiyadla.
High blood dangerous likangunwa medication ya lena likitlhokomela high blood ya bulaya.
Wow, there's so many misconceptions around hypertension and compliance to treatment. I think what we also did here is that hypertension is a dangerous condition and that compliance and adherence to medication is important. Dr. Mayayise, please can you iron out some of these misconceptions, and can you also please explain why it's important to take our treatment?
Yeah, at first I'll just take that one who's talking about erectile dysfunction. That as we mentioned, the complications, it's a vascular complication, and erection can be affected when the vessels are sick. So it's a misnomer from the gentleman. He's been misinformed. I think it's worthwhile advising people at home to take their medications and make sure their blood pressure is controlled. And then there are all sorts of side effects from the cough, swelling, and those things. I will advise patients that probably what we'll recommend is they go and consult their doctors once they start experiencing symptoms. Then they can be able to tease it out, what is it, and then they can be able to tailor the medications accordingly.
I think let's hear what some of the viewers have to say around hypertension. We'll take a few questions. The first one asks, the nurse told me that I have hypertension and I need to change my diet. What do I need to do? The second question asks, I am worried that I will get infected if I go to the clinic to collect my treatment. Can I stay at home until it is safe to go to the clinic? And that is from Busi Romo from Frede. And the last question is, I have hypertension. Will I survive if I contract COVID-19? That is from Lizzie Ware from East London. Dr. Maisa, please can you help us address some of these questions?
Yes, so the first one has to do with diet. So hypertension, part of its cause is a lifestyle disease. So which means we have to watch what we eat. And then if you have to change the diet, you have to reduce the salt, you have to watch excesses like reducing the sugar and so on. So yes, they need to change their diet, adopt a much more healthier diet as part of the treatment, including the medications. So medications alone, it's not the treatment of hypertension. Exercise is also part of it. COVID-19, the restrictions of movement is already what we've already covered, that the patients need to go and get their medications. They're allowed to do so, and then they must not fear hospital facilities or healthcare facilities because they have put in the protective measures to prevent the spread of the disease in the hospital. It's actually one of the safest areas that you can be as far as contracting COVID-19 is concerned. So I will encourage them that not to skip their treatment because of that reason. They just need to go and get their medications. I thank you.
Mm-hmm. I'll ask one or two more questions. I think from my side, perhaps maybe let me ask, is hypertension only for the elderly or can young people also get hypertension?
Young people can get hypertension because it is a lifestyle disease, like we said. It is linked with the obesity. So now we're starting to see hypertension to children as young as 12-year-old, as young as 15-year-old. And then there are also some genetic causes of hypertension that can happen in the younger children.
All right.
The next.
Yeah, all right. Carry on, Doreen.
Okay, I just want to find out, if I feel healthy, if I've got hypertension, is it necessary to continue to check my blood pressure and take treatment?
Yes, the campaign says know your number, so which means we want to get the numbers below 140/90, because at that level, the damage to the blood vessel is not as much. But once we go higher and higher and higher, the higher it is, then the worse it becomes. And secondly, when complications develop, like if kidney complications, control of blood pressure becomes much more of a problem.
All right.
Thank you.
So maybe just to slot in one or two other questions, I think that people may be talking. I mean, just the concept of treatment and to help people stick to treatment. Can we just cover, the whole notion of treatment and possible side effects? Because, some people even go to the extent of, stopping their treatment because of hypertension and because of side effects and so on. Just take us through, the principles around treatment for hypertension.
So the principle of treatment of hypertension, firstly, is the lifestyle, which we're talking about, the diet, the healthy diet. They need to exercise, they need to cut down salt, stop smoking, and then try to reduce the burden on damaging the blood vessel. And then secondly, it is the drugs that control. So the drugs targets different mechanisms, and they can have a combination or have one drug, but this is going to be tailored by the doctor who's going to be treating them. And then side effects can happen, like they can have swelling of the legs with some of the drugs, cough, or they can have a swelling of the throat, and then they can't breathe with some of the drugs. But all this can be managed by the doctor who's treating the patients. Okay. So when you get side effects, the best thing is not to stop the treatment, or what happens in the township, you not go and ask treatment from your neighbor. Go and see your doctor, and then you get help.
Right. just how I wish we had more time to delve a little deeper into some of all of these things. Now, time for another quick break. When we come back, we'll now wrap up and give you some take-home messages about hypertension during this pandemic. Please stay with us.
Now, let's summarize some of the key messages from the show today. The first are the symptoms of high blood pressure. Most people do not know they actually have any. Half the patients actually do not know they even have high blood pressure in the first place. However, high blood pressure is classified as a systolic blood pressure of more than 140 over 80. Can you hear me?
Yes,
Sorry,
we can.
I have a bit of a delay.
We
Okay.
seem to have lost a little bit. And,
There are lots.
Yeah. We're
There are
going to
lots
now
of
talk
complications
about
that
some of the
people may have.
complications of hypertension.
There are lots of complications that people may have. They vary from multiple systems affecting the brain, the heart, the kidneys, and as well as the sexual organs. So a person can have a stroke, a person can present with heart attacks, or they can present with heart failure. They can also present with kidney dysfunction, or as well as erectile dysfunction.
All right. Some of the other key messages that we'd like to leave you with is the fact that, it's important to stick to those changes that matter. A healthy lifestyle is very important, firstly in prevention of high blood pressure and treatment of high blood pressure. So you need to go out there and be regularly active. Quit smoking. Smoking is bad for you. Manage stress, and during this pandemic and beyond, please just ensure that you take your medication as prescribed. When it comes to your diet, eat healthily, maintain a healthy weight, reduce salt intake, and limit alcohol. Now, of course, we said that it's important that we regularly go for our checkups. And if you have hypertension, as you heard, most people say that they do whatever it takes to ensure that they take their treatment and make sure that they go to the clinics or their doctor to get their treatment checked. Over to you, Doreen.
Time flies by so quickly, Sello. Unfortunately, it's brought us to the end of the show, and I'd like to thank our guest, Dr. Mayayisa, for joining us today. It was quite a fruitful session. Thank you very much.
And we want to thank you, our viewers, for watching this show. And it's really a great pleasure to be with you again. And Dr. Mayayisa, would like to thank you so much. Perhaps you want to leave us with your parting words.
Thanks for the privilege and the honor. From my side, we just have to look at hypertension in its context, that it is a atherosclerotic risk.
Yeah.
Together, we have to look at diabetes, we have to look at cholesterol, like doctor also mentioned, smoking cigarettes. So if we can look at them as a package, then it will be able to help and know your numbers. Yeah. I thank you, and I thank the viewers at home.
All right. Okay. I think that's basically where we're going to leave it, and we're going to be back with you in a week's time, same place, and we're going to send this over now to Doreen to just tell you a little bit about our social media, story about how you guys can leave us with your questions and how we can interact. Doreen?
Guys, remember to send us your questions via SMS, via WhatsApp, on Instagram, on Twitter, on Facebook, and as well as on our hotline. But before we go, I just would like to remind you, please wear a mask, wash your hands, keep social distancing. And if you do have any chronic comorbidities, please go to the clinic. It's important that you adhere to your treatment. We don't want any complications, please.
All right, that's it from us. And until next week, please do stay safe. And as we say, akari tlhokomeleng. Cheers for now.